Welcome everyone. We're really excited for this webinar that is co-hosted by the Super Study, the Scale Up of Parenting Evaluation Research, and the Global Parenting Initiative. And it's a great opportunity to learn from some of our experiences over the last few years on taking parenting programs to scale in many different contexts around the world. And then also we're going to have an opportunity for us to break up into smaller groups and share a bit more about our experiences and challenges and have more of a discussion. I have apologies from Professor Kathy Ward from the University of Cape Town, who was the chair of this webinar, but has taken ill and won't be able to make it today, this morning or afternoon for those of you in Southeast Asia. So we're really excited to hear from colleagues from Montenegro and the Philippines and others about the challenges and successes of engaging government in scaling parenting programs. And I'll hand it over to you, Genevieve, to do any housekeeping for people who are joining. And if you could make this full screens, or this is not, will people be sharing their own presentations?
Yes. Some people will be sharing their own, and I think there's only one that I'll be sharing. So thanks for that, Jamie. I'm just going to have a look at just to pull up the agenda. So before we get started,
I forgot to mention that we're also having presentations from Botswana, Zimbabwe, and South Africa and Uganda. So a lot of different experiences will be shared in this session, and really excited about that. Back to you, Jen.
Thanks so much, Jamie. So yes, so thanks again to everyone for being here, and also to say that we are recording. If you have any objections, just let us know. There's quite a bit of people that's interested in these presentations and this webinar, but wasn't able to make it today. So just to take you quickly through the agenda for today, we're just having brief introductions or overviews from a number of our organizations, or the organizations that we've been working with in Super and as well as GPI. And so this is just a background, just to give you an overview of the work they've been doing in their countries and how they've been working with government, or trying to collaborate with government to take parenting programs either to scale, or just to get a government involved in the ongoing parenting programs in particular countries. So these will be quite quick, quite brief, 5 minutes per country. And then we'll get into some of the work that Montenegro and Philippines have been doing, and they'll be sharing their experiences in how government has provided support with parenting programs, but also giving us an idea of some of the challenges in getting government to be on board with these programs and to assist in various ways. Then we'll be having some short breakout sessions. This is really for people to get down to discussing, asking any questions, really opening up the discussion so that we have an engagement on how people have been working. So we're really looking forward to the session, and welcome again to everyone. I'm going to hand straight over to Botswana. I know Lisa is on the call. Welcome, Lisa. Who'll just be giving us a quick overview on some of the work that's been happening in Botswana, and specifically with Stepping Stones International. I'm going to stop sharing. There we go. Hi, Lisa.
Hi, everybody. Thank you so much for this opportunity. I don't have slides because Yelda told me I just need to talk. So that's what I'm going to do, and just kind of share our experience.
Perfect.
And just so that you know, Stepping Stones International is a non-governmental organization, and we've been working in Botswana for 15 years. And we work with orphan and vulnerable children and their families. And we, in the past, have tried out 3 different parenting programs, including Families Matter, PET, and then another one called Safe from Harm. And nothing has really worked for us for different reasons. The reasons mostly being, and we've done research on that recently, qualitative research on what different parenting programs there are in Botswana. And one of the reasons they haven't worked is some of them are too strict. Some of them you can't do makeup lessons, and some of them were culturally inappropriate. So based on that, we were looking for something that would be more appropriate, and we came across Parenting for Lifelong Health. And the process we took was to involve the government from the beginning in contextualizing and also to naming it. And so in Botswana, it's called Pinahari. And we started about 2 years ago. The government was on board from the beginning about, you know, the contextualization and about the renaming. And they've also been involved in, well, peripherally involved in doing the research. So we've done a step wedge randomized control study, and wherein you do a pre-test with the first group. You recruit everybody at the same time. You do a pre-test with the first group and a post. And then every time you start a new group, you also continue to do the pre-test with your original group so that you can see maintenance of behaviors. This parenting program is actually working in Botswana. So we've scaled it up. We're in about 5 districts with it right now. And what we've done is we've included it into the national dreams. We have dreams in Botswana under USAID. And so we have included it as one of the contextual services for dreams in Botswana. So now it is a household name, which is what we've done very well. And we've been able to get a lot of testimonies and continue with the research, both qualitative and quantitative. The problem is for sustainability purposes, that trying to get the government on board as far as infusing it into the jobs of the social workers. We originally trained a few social workers and then they just dropped it. We tried to include them in the co-facilitation and then they never carried it forward. And so we are trying desperately to work with the government. They like the program, but to work with them to get it so that now the social workers are trained and it's part of their job description, and that they're taking it out to the districts and they're the ones who are implementing with us, co-facilitating at the beginning and then handing it over in the end. That process has been so difficult, trying to get them to understand that if we actually do this program, their problems later on will be lessened because there will be less violence in the families, more families will be in tune with their teens. We do the teen program, by the way. So that is where I would love to hear from others today, is how do we work with the government? And I know every government is different, of making sure that it becomes part of the social worker's job description, or if there are other mechanisms of getting it out there. Currently, we've trained 5 other NGOs, non-governmental organizations, to implement this program, and they are carrying it forward. So that is one methodology of keeping it sustainable, to continue with them, and also to, you know, making sure that it is at the national level, which is where it is, but it just isn't being infused into the government systems. So I think with that, and Genevieve, you want me to say anything else? I think that summarizes what we're doing with Pinahari and how we parenting for lifelong health and how we need help also. Thank you for this opportunity.
Thanks so much, Lisa. I think that was perfect. It was a great overview of what you guys are doing in Botswana. I'm going to hand over to our Zimbabwe team. So this is the Catholic Relief Services. And I'm sure if we're in the breakout sessions, if anybody has any questions or comments, please pop it into the chat. We can keep an eye on that, and people can respond directly to that, whoever's presented. So can I hand over to the Zimbabwe team? This is Mike Gerald, and I'm not sure who else is on the call because I can't see everyone, but I can share screen. Mike Gerald, Richard, would you like me to share screen?
Sure. Thank you so much, Genevieve.
Awesome.
Yeah, Richard is also on the call. Yeah.
Awesome. There we go. Just let me know once you can see that, and I'll do.
Yes, thank you, Jen. I can see the screen.
It's giving me a bit of an error message. 1 second. There we go. Is that good?
Okay, great. Thank you so much, Jen, for sharing my screen, and welcome everyone, and thank you for this opportunity. I'll be presenting on behalf of Catholic Relief Services from Zimbabwe, and it's a Pathways project, which is in its 5th year. So it's an HIV. Can you move to the next screen, Jean?
Sorry, there's a bit of a delay. Has it gone?
No, it hasn't, but let me just continue as you try to
There we
move
go.
the screen. Yeah, all right. So it is an HIV sensitive OVC project that is child-centered, family-focused, and community-based, and evidence-informed. So it's contributing to epidemic control and improved social protection landscape. So it's funded by PEPFAR through USAID, and this year marks the 5th and final year of implementation in Zimbabwe. So the OVC activities contribute to HIV epidemic control, either directly or indirectly, through supporting the most vulnerable children and adolescents, girls, and young women to prevent new infections, and supporting children living with HIV to achieve viral load suppression. So using the DREAMS, we also use DREAMS. So DREAMS is critical in that we, in our implementation, because we also have the layering of services. So this includes referrals between pathways and other DREAMS partners, so that we have optimal service provision for our girls and young women. Let's move on to the next screen. So in terms of scalability, we started in FY18 with curriculum adaptation to the ZIM and pathways context. That was in, yeah, then we moved on to, we're in 4 districts where we piloted Synovio. So we're using the PLH Synovio model. So 84 facilitators were trained and 13 coaches were trained, reaching to 5,216 households. Then the following year, we had 87 facilitators trained and certified. 13 coaches again were trained and certified. Then our 13 trainers were certified as well. Then we had reached 12,691 households. Then we scaled up to 2 more DREAMS districts and 4 OVC districts to make up to 10 districts from 4 to 10. That was a scale up. So we had 104 facilitators trained. They were not certified in that year. Yeah, I think that was when COVID started. Then 11 coaches were trained and certified. We had no trainers there in that particular year. We're reaching to 9,100 households. Then in FY22, we had 61 facilitators trained and 109 of them certified, and we're still in the process of certifying the rest, the remainder of the facilitators. 21 coaches trained and enrolled and certified. Then we have we reached so far it's 54,014 households. So it's an accumulative total of 81,111 households. So in terms of working with in these figures, you'll find our 19 Department of Social Development officers whom we trained. And we also find 11 community care workers who so come from the government, and 14 were trained in 2020. So in total, we've got 25 community care workers that we have trained so far. So these are based in the wards and they are directly work with people. So this was also a strategy in terms of working around our district officers. I think I concur with Lisa that the government is very supportive, but the guys on the ground, the social workers, are mostly busy and sometimes they move. So we have a high attrition rate of social workers. So our community care workers, they are permanent in communities, they stay in their communities. So they are our buffer and our strategy in terms of working with government through them. I'll hand over to Richard to move on to the next slide. Thank you, Jane. Hello, Richard.
I can't actually see if he's on the call material because of the sharing of screen. So he might not have joined.
Jen, could you exit and re-enter so as not in presenter mode so we can see this a little bit bigger because it's quite small.
Oh, sorry. Let me try
Thanks.
that again.
I think, McGerald, you're going to have to talk us through this slide. I don't see Richard as part of the call.
All right, Jamie, let me continue. Yeah, sorry
Just
about
let me
that.
know if that's better, or do you want me to
go to presentation, like slideshow, and just
switch the view?
see here you have the we can see the next slide.
Oh, I see. Okay, I know what to do.
Thanks.
That's the way that I've shared screen. So give me 1 second. Is that better?
Yeah, it's a lot better. Thanks.
Awesome.
All right, so let me take you through this one quickly because I think my 5 minutes is up, but I'll just rush through this. In terms of how the Synovio Teens program has shaped the Zim parenting landscape, in terms of policy influence, the government is on board regarding this parenting initiative. And recently, we attended the JIP Symposium for Africa. So we had the director of the Department of Social Development sitting on the panel. So that for us, that says a lot in terms of the buy-in in terms of government at that high level. So we have some statutory instruments that would support the parenting, the Child Justice Bill, the Children's Act, the National Action Plan for Orphaned and Vulnerable Children. Then there's also a move towards a parenting strategy, which does not exist within our framework. So I think I've told you about I've also shared the numbers and in terms of the government workers that we have trained and the uptake. I think like I referred to Lisa's slides that I think the critical staff, which is the middle level, the social workers who are in the districts, are not really forthcoming. I mean, all of them. It's not all of them. Some of them are very active. You find some have got excuses, but like we said, our strategy is to use the community care workers who stay in the communities and who are permanent in those communities. Then in terms of institutional investment, so ECRS has invested in facilitators, coaches, and trainers. And also at a global level, CRS has also introduced a strategic change platform on family strengthening, with Synovio being a model. Then we're also participating in the global evidence generation through the participation in the PLH super study. So we believe that the future is bright with our government participating in the JIPS symposium. So I think a lot is going to happen, and we're looking forward to parenting, especially the Synovio model, the PLH model, becoming a model that the government will adopt and use around its strategies. I'll end here, Jen, and thank you so much, everyone.
Thank you so much, McGerald. There was quite a few comments in the chat just about sharing the slides, so thank you very much for the presentation. I'm now going to hand over to Shande from the Institute for Security Studies in South Africa. Shande, are you on the call? Let me just go out. Let's have a look. Was there another colleague? And I'll just Shande. I don't see you on the call.
I think we might need to then skip and move on.
Yes, we'll do that. We'll do that. So the final short presentations from our country partners is with Uganda, and that was Godfrey, or at least Godfrey had asked somebody to join in order to do that presentation.
Yes, Carol here. I'll be
Hi,
doing the
Carolyn.
presentation. for
Thank you
Uganda.
so much. Thank you. Will you be sharing slides, or will you just be talking to the work that you've been doing?
I'll just be talking since it's only 5
great.
minutes.
Thanks so much. You can go ahead.
Thank you very much. My name is Caroline Namtebibiekwaso, and I work here at Child Health and Movement Center, Mackay University. Just to re-echo what we do, Child Health is a multidisciplinary teaching and research department within the School of Medicine, Mackay University, whose main mission is to improve the health and the well-being of children and their mothers. And so we do this through teaching here at the university and also undertaking innovative research, like part of the work that we are doing here now, and also capacity building to improve health of children and that of women. So for over years, Child Health and Development Center has been with her collaborators. I am happy to say that Oxford is one of the collaborators for the work that we do here at CHDC and Glasgow University. So online with us, we have Jamie and Godfrey Siu, who are also part of the work that I'm going to be talking about. So we have been involved in research and parenting work. We started with the Parenting for Respectability project, and this project provided us with a platform or a foundation to appreciate parenting work in the country, but also to realize some of the gaps within, parenting and violence prevention work. And it gave us evidence and kind of prepared us to start shaping parenting interventions in the country. So as that, we now started a program that I'll be talking about shortly. But what made us easier for us to help government appreciate parenting as a good investment for the country, I want to start by explaining from the global and the national environment. We all know that the Sustainable Development Goals, that is 16 and 5, talk about family and strengthening the family, prevention of violence for women and children, and other areas that emphasize prevention, strengthening the family as an entity. So at such a time globally, we had the INSPIRE, and Uganda as a country adopted the INSPIRE Global Strategy to End Violence against children and adolescents. So this provided the need for evidence-based work within the country. And also at that time, in 2018, as Uganda, we came up with the national parenting guidelines. And these guidelines provide an opportunity, but also a framework. Excuse me. Richard, can you tell that lady to move on? Sorry for that. I was talking about the national parenting guidelines. The guideline is a very important instrument in the country because it provides information to stakeholders that help parents and caregivers to acquire key knowledge and skills, but also provide as a general document for standards and principles that can improve parenting work in the country. So in Uganda, we had the Violence Against Children report after the mapping. And this report, which was done between 2015 to 2017, provided the need, one, to adopt the INSPIRE Global Strategy, but also for a country to invest into parenting work because it provided gaps, and also the magnitude of violence against children was displayed out there where it happens most, and caregivers and parents were seen to be as one of the perpetrators of violence against children and youth. So this environment was good. And politically also, the government, through the president of Uganda, declared 2018 as the year of the family. this was a suitable environment for CHDC to come on board and collaborate with the Ministry of Gender, Labour and Social Development to start the Parenting Agenda Initiative. So we came up with a program, a Parenting Agenda Initiative, whose main goal was to develop, to provide strategic direction and leadership and provide a platform with stakeholders to generate a consensus and optimize parenting of evidence-based parenting interventions for early prevention of violence across the country. So this, we needed to generate consensus on what parenting work should look like in the country. But also it gave us an opportunity to show the need to provide evidence of the need for evidence for parenting interventions if we are to prevent violence against children and adolescents. So through the process, we decided as members of the consortium in this project to do the mapping of parenting interventions in the country. Why? Because after developing the program through the Ministry of Gender, Labour and Social Development, we did the mapping up and created a database for all partners in the country that are involved in parenting interventions. And these came together to start a process of consensus and development of a national strategy or an agenda to shape parenting work in the country. So through that process, we went into the mapping exercise. And the mapping exercise revealed the need for evidence programs within the country because we realized that there were so many parenting work. There was a lot of interest, but most of the program were fragmented. So then the mapping was like the benchmark for how should parenting interventions look like within Uganda. And after the mapping, the consortium members resolved to have the standards so that just like it is with the education sector, where teachers across the country, no matter where they are, they have the national standards which guide their teaching. So we then decided as a consortium to come up with the Uganda parenting standards as a document that will guide parenting work across the country. So the standards provide the minimum. What should it look like? And evidence-based parenting work comes out strongly in that document. And as a result of the standards, still with the work with other partners who are part of the Parenting Agenda Initiative, we are now in the process of developing the Ugandan National Parenting Program, which will be a manual that every implementer or agency that is interested in family strengthening and doing parenting work in the country will be using across the country. And these are very strong initiatives that have come up, building from the work that we did, the research that we already do through our parenting work with the Parenting for Respectability program. But interestingly, in the Parenting Agenda Consortium, the nature of its implementation, the structure that was put in place at the Ministry of Gender, where every member of the consortium, who is also from an organization that implements parenting work, has an opportunity, one, to share their work, to learn from one another, to build a case of what works and doesn't work. This has created ownership, interest, trust, openness, and communication within the members. And also it has helped members to know that we have the same agenda. All we want is prevention of violence against children, but also we want to see that parenting work in the country is shaped.
Carol,
And
thanks. Thanks. We just have a limited time of 5 minutes per presentation, but this is showing that we really could use more time for all three of these amazing case studies. So we'll definitely want to spend more time at another date learning from what you have been doing in Uganda, both within the guidelines, the Parenting Commission, Consortium and with the work that you've done with Spring Impact. Sorry to have to cut you off, but we have to move on to the next presentation.
Thank you very much.
Thank you. No, this is really incredible.
Yes, thanks so much, Carolyn. Thanks, Jamie. And I guess also to say that this could be one of the first webinars in this series. So we have been thinking about bringing all of our partners together and having people have this conversation more broadly. So like James just said, this definitely shows that we do need additional time. And at the end of the session, we would like to get some of your feedback about that and taking it to having a number of additional sessions after this first one. I'm not sure if anybody from the Institute for Security Studies have joined. There was a few people that have joined, but I'm not sure if anybody is able to present on the work that they've been doing. I never got a message. So what I'm going to do is I think we can go ahead with our agenda, and I'm going to hand over to Ida.
Genevieve?
Yes.
Hi, I'm Diketso from the Institute for Security
there
Studies.
we go. There we go. Hi there. How are you?
I'm good. How are you?
Good, thank you. Do you have a overview or introduction presentation that you'll be sharing with us?
I just have a few words, really.
Perfect.
Just to speak
You
about
can go
how.
ahead.
Okay, perfect. Good morning, everyone, from a very, very chilly Cape Town. So I have been asked to give a short input on how the Violence Prevention Forum has placed parenting programs on the policy agenda in South Africa. So just for a brief background, the Violence Prevention Forum was established in 2015 to improve the use of evidence to guide violence prevention policy, funding, and programs. It brings together experts from multi-sectoral sectors to work collaboratively together towards the uptake of evidence-informed violence prevention. It's also been functioning for 7 years. We've met 14 times, and it is currently now a high-functioning, democratic, collaborative network and a forum for dialogue where people and organizations from different sectors can talk and think together with a common commitment. So in 2015, when the Violence Prevention Forum started, we didn't really have all the data and the evidence that we have now for parenting programs and their impact on violence. But what we did have were researchers and non-governmental institutions that believed in their power. So this saw collaborations between us, the Institute for Security Studies, UCT, and a community-based organization in the Western Cape to try and assess the impact of parenting programs in one community. Today, the project has been concluded after 7 years of careful data collection and analysis. And what we now can show is that parenting programs can have an impact on the overall well-being of caregivers and children, relationships between caregivers and children, and that they have a positive impact on reducing parental stress, especially when it comes to stress around parenting. So as the Violence Prevention Forum, we developed a theory of change about the 5th year of our existence, because we realized the importance of being able to articulate what we do, why we do it, how we do it, and what our desired end goal for our work is. And with our theory of change, we identified 3 pathways for our work. So the first one was relationship building. The second one was building of the evidence. And the last one was strengthening the workforce. So this has helped us to show how we have achieved greater attention to violence prevention programs, such as parenting programs. And the work that we have done in each of these pathways has enabled us not only to show the impact of parenting programs, but also to ensure that their power is recognized at policy level. So by building relationships and capacity and confidence in individuals within our violence prevention network, and by building the evidence of what we know works to prevent violence, we have been able to put parenting programs on the policy agenda in a very practical way. So for example, in 2019, when the Department of Social Development managed to receive a budget line item for prevention of violence, that was because of our influence. Along with this, we have managed to influence the inclusion of parenting programs in the National Strategic Plan of GBV and Femicide and in the prevention strategy. So I'm just about to finish off right now, but I just want to talk about how our different pathways have helped us to see our work quite actively. So in the first pathway, by building and enhancing relationships between NGOs, researchers, and government, we have been able to enable multi-sectoral stakeholders to speak about and craft solutions to violence. Their relationships have allowed a platform for unpacking and understanding evidence to ensure that they're able to use it in all of their sectors to inform the decisions that they make individually in all of their work. Secondly, through our evidence pathway, we have not only produced but also showcased the research that we know about what works about parenting programs, specifically in our context in South Africa, because we've learned that context and adaptation is everything for program impact. We now have research that tells us what programs work and in what contexts. We now understand more about the delivery of parenting programs and the return on investment on them. And finally, we have a model that tells us how to fund and deliver these programs at scale. Lastly, through the capacity building pathway, we are delivering a facilitation course that has been carefully crafted by our VPF facilitators and other people and experts in alternatives to violence. And this, along with our VPF meetings, which are founded on a set of values and a now codified definition for violence prevention, we have been able to build confidence in the individuals in our network, so in government, in research, and in the NGO sectors, to be able to articulate violence prevention and what works to prevent violence, and to be able to engage with one another in conversations with each other that flatten hierarchies of knowledge and power and are characterized by mutual respect and care for one another. And along with our theory of change pathways, we really do believe that the Violence Prevention Forum has helped put parenting programs on the agenda in a big way. And in this year, we have been actively involved and we are making headway towards implementing these programs at scale. I think I'll stop there because I know that it's only 5 minutes. 1 minute left. Okay, cool. So maybe I can share our violence prevention definition, because this was co-defined and co-crafted by members from government, research, and NGOs last year. And it reads as follows. So I'll read it quite slowly. So it says, violence prevention is the whole of society working deliberately and sustainably to remove sources of harm and inequality and heal woundedness by intentionally growing an ethic of mutual care, respect, and inclusion to build peace. So this is a definition that we have co-created as the Violence Prevention Forum through a whole long process that was very consultative. But what we are now trying to do is use this definition in all of our spaces to try and articulate the work that we do, but also to try and see, where in our spaces and in the work that we're currently doing, are we actually doing violence prevention? So I'll stop there. That's it from me. Thanks, Genevieve.
Thank you so much. And thank you for sharing the wonderful work that you're all doing. You can just check the chat as well. There's a few comments that have popped up where people are asking where you can find some of your research and research findings. So please just maybe pop something into the chat. Thank you so much.
I will. Thank you so much.
Thank you everyone for sharing your country overviews and some of the work that you've all been doing. We're now going to hand over to Montenegro, specifically Ida, that will be presenting on how their experiences with government support, with parenting programs, including some of the challenges and how they've navigated this. So I'm going to hand over to Ida, if you are on the call.
Thank you.
There we
just
go.
turned on my camera. I hope you can see me and hear me.
I can hear
I'll turn
you.
off my camera though because of bandwidth, but just want to say hi before I switch to my presentation. So I hope I'll be able to share it, but I've also shared it with Jen in case it doesn't work.
Sure.
But I think it will work. Yes. I hope you can see it now.
Yes, we can. If you can just pop it onto presentation mode, then we'll be able to. There we go. Perfect.
Full screen?
Perfect.
Yeah? All right.
Yes.
Perfect. Okay, so I'm going to present the case study from Montenegro, and just so you know, it's a very small country in Europe. It's a middle-income country which regained sovereignty from the Union of Serbia and Montenegro, formerly Yugoslavia, in 2006. It has a very small population, and please keep it in mind when you look at our figures later on in the presentation. We're a very small country, so we cannot reach as many parents as Zimbabwe did because we don't have that many parents in the country. Montenegro has a very high Human Development Index, and it is a member of NATO and aspires to join the EU, so it's an EU candidate country. So it's basically a country that is undergoing transition and a lot of reforms, which are kind of mostly driven by the EU agenda. When it comes to violence against children, it is very widespread in Montenegro, and here you can see results from the multiple indicator cluster survey, which shows that only 18% of children experience only nonviolent discipline. Physical punishment is experienced by around a third of children, and psychological aggression by about 2/3. When we look at age patterns, you can see that children aged 3 to 9 experience violent discipline and physical punishment more than other age groups. The second part of the slide is very interesting because it shows that about 10% of caretakers believe that physical punishment is necessary, but about 1/3 of children actually experience physical punishment. So we believe that this discrepancy points to this, potentially to this actual lack of parenting skills. So it is not that parents want to use physical punishment, but sometimes they feel like they have no choice. Okay, sorry, my slideshow got stuck. Okay, I hope you can see the next slide. So protection of children from violence is high on the political agenda in Montenegro. Corporal punishment was prohibited in schools quite a long time ago, a relatively long time ago, about 2 decades ago. But corporal punishment was prohibited in the family law in 2016, so it was also prohibited to parents to use corporal physical punishment. Then we had the first ever national strategy for the prevention and protection of children from violence in 2017. Montenegro also became a pathfinding country of the Global Partnership to End Violence Against Children, and UNICEF supported the government to run an End Violence campaign in 2016 and 17, where the idea was to really sort of increase public debate on all forms of violence against children, including online violence, adverse childhood experiences, domestic violence, child marriage, child sexual abuse, and importantly, positive parenting. And I believe this was really the first time that positive parenting was debated at the national level. Based on all this, we organized some conferences, and we heard about the Parenting for Lifelong Health initiative, and some of them spoke even in Montenegro, and we embarked on this journey of introducing parenting programs. We had a stakeholder meeting with the Ministries of Education, Ministry of Health, Ministry of Labor and Social Welfare, and some sort of reputable NGOs to discuss whether they would like to, engage in this experiment, really, and they agreed. So again, my slideshow got stuck. So I hope you can see the next slide. We decided to introduce the Parenting for Lifelong Health for Young Children program, which we branded in Montenegro as Caring Families. I believe this is what Sinovuja also means. In Montenegrin, it is Brižne porodice. This is our house of support as we rebranded the program. And as I said, we decided to target children 2 to 9 initially because of these high rates of violence against children in this particular age group. So we had the first cycle in 2018 which was accompanied by an evaluation. So we had 17 group leaders who delivered the program under supervision through regular service delivery in healthcare centers, in non-governmental organizations, and we had one kindergarten at the time. And for the study, we had 82 parents who were recruited, 79 who completed the pre-program questionnaire, 71 who enrolled, and 68 completed the pre-program questionnaire. So basically, we had a pre-post evaluation without a control group. So I know it's not the golden standard of RCT, but I think it was still, as rigorous as it could have been under these circumstances. And we had some really, really good results. Translated into percentages, which policymakers like, and personally me too, we had a 70% reduction in harsh and abusive parenting, 86 in physical discipline, 60 in emotional discipline. Now looking at secondary outcomes, we also had some wonderful results, reduction in dysfunctional parenting, child behavior problems, parental depression, also very significant. And we had extremely high parental satisfaction. And you can see on these graphs, all the grades were above 4.4 out of 5. And 5, the one that you see, the bar that shows 5 is recommend program to others. And actually, even afterwards, in our subsequent cycles, we haven't had a parent yet who would not recommend the program to others. And the developments from there on were that we had 9 cycles so far, 19 implementing partners in 7 municipalities, but more are being trained now. So hopefully from September onwards, we'll have 11 municipalities, which would be half of the country. And in terms of population size, in fact, we are already targeting the largest municipalities. And you can see here on the slide that our partners are health centers, kindergartens, NGOs, primary schools. We have an education resource center and an institution for rehabilitation of substance abuse. And we've had 4 generations. You can see these pictures, the 4 training events that we had of facilitators or group leaders. So we trained 98. They're mostly psychologists, medical nurses, educators, social workers, and pedagogues. We have 6 certified coaches, and we should have 12 by the end of this year. And by the end of this year, we should have 2 national trainers. And so by until like a week ago, we've had 848 parents recruited, and about 85% of them received certificates of completion. But just considering the size of the country, which is less than 1 million, 620,000, this is quite an impressive figure. So I just want you to put this into perspective. So now moving on to the most important part of the presentation, because it's actually the topic of this webinar on how to make this program embedded and sustainable. So this has been sort of our strategy. So we've been working on building a PLH workforce of professionals, as you could see, trying to increase the number of group leaders, coaches, and trainers. And the idea is to make the program cost efficient so that we have national expertise to sustain and to expand the intervention without having to rely on external experts, so just making it also less costly. We've also invested time and effort in having these programs nationally accredited by institutions that accredit training programs in Montenegro. The idea was to make this training program attractive for professionals. Sort of this is an additional incentive for them to take the training. This also provided some kind of assurance for the ministries that these programs have like a stamp of quality, national stamp of quality. So it really worked. Then after we did this evaluation of the first cycle and a smaller one of the second cycle, we've been collecting evidence throughout. It's not scientific and rigorous, but good enough for policymakers, I can tell you, and for donors. So we've really invested efforts in always collecting evidence so that we can provide annual reports and data in events and conferences to show that this program is really working. We've, as I said, used this evidence for advocacy events and to celebrate successes. And we've used these events really to sort of spread the word, but also give recognition to partners who are implementing the program, because that's additional motivation for them to continue. And I can tell you it really works. One important advocacy mechanism that we've used is to present this to the Parliament of Montenegro, and the Committee for Human Rights and Freedoms in 2018 recommended scaling up this program to all municipalities. And you can see the link here. It's in Montenegrin, but just to sort of prove that this is what really happened. And I'm also really, really pleased that the Ministry of Education included Parenting for Lifelong Health as a specific activity, or in fact 2 activities in the strategy for early and preschool education, because the Ministry of Education is really really wants to expand this program in kindergartens, because it worked really well. So starting from 1 in 2018, we will have 11 kindergartens in September delivering the program. So that's quite impressive. Our work in progress, because this is not all rosy, there's still work to be done, is to find a sustainable funding mechanisms, because the PLH is being delivered by services, routine services like health centers, NGOs, and okay, not maybe NGOs are not routine necessarily, but kindergartens and health centers. They're funded by the kindergartens and health centers. So we as UNICEF are not funding implementation. However, it still remains an issue, because it is a middle-income country, and funding is always short and staffing is always short. It can sometimes depend also on the willingness of the managers to allocate funding, to pay their staff for overtime work when they do this job, in the evenings, in order to reach parents who are working. And so it's something that still we're trying to find ways through regulations, to see how we can, justify this additional spending on parenting. And unfortunately, Montenegro is still sort of gradually and very slowly introducing program-based budgeting. So it's not like that fully right now. So it also makes it difficult and not so visible, where this program goes. So this is sort of our main focus now, to sort of advocate for certain regulations and mechanisms and insurance funds to include this program. And we are also advocating for the governance of the program to be transferred to the government, because right now it's still being done by UNICEF. So UNICEF is still sort of coordinating training, planning when training takes place, and monitoring implementation and collecting data. So all of this should really go into the hands of the government, and it's a full-time job. So it's something that we're still working on. Sorry, slides get stuck when I spend too much time on them, apparently. So I think it will, hopefully I'll be able to transition to the next slide soon. Basically, the next slide is just a visual representation of our plan for the future. So basically, we are going to support the Ministry of Health, who's been tasked by the government of Montenegro to develop an early childhood development strategy. So we are going to have a chapter on parenting as sort of our entry point, and sort of one of the domains of the nurturing care framework. This will be a way to sort of really highlight parenting. We try to do that through different strategic documents, and I already mentioned this early strategy for early preschool education, but in ECD strategy is a cross-sectoral strategy, and since we're working with different sectors, we find that it's really important to have a cross-sectoral strategy on parenting, and hopefully also as one of the measures, we will work on developing national guidelines on PLH. Then we will, of course, continue to invest in training of new PLH staff, because we need to expand geographically and to involve as many services as possible. Then we are doing a much better job promoting the program. We were criticized by parents themselves that this is such a great program, but we're not speaking about it in the media enough, although the parents are very good promoters themselves. So we're doing much more of that now with the branding of the program. We're also going to work on referral. With the Ministry of Labor and Social Welfare. So you could hear from my presentation, I've heard from other countries that a lot of countries are working with social welfare services and social workers. And in fact, we haven't. And, you know, just like you said, you know, in other countries, I think in Zimbabwe, I believe that I heard, our social workers are also extremely overburdened. And they're mostly working at the tertiary level and with the most vulnerable and sort of putting down fires, you know. So they're not really able to absorb more workload and deliver the program, but they would really like to have referral mechanisms so that they can refer parents to preschools and to health centers who are delivering the program, so as to make sure that their their clients who really need you know, this kind of support and all kinds of support can also benefit from this program. So this is something that the Ministry of Labor and Social Welfare has expressed as their need, and we're going to support them. Then we have been sort of trying to gradually reach as many vulnerable parents as possible, you know, working with the Roma, excluded families and children with disabilities. So we are going to work on adaptation of the program to sort of tailor it a little bit more to these families. I'm sorry, I had to stop sharing because I would like you to see this slide. So I'll just try to share again. So this is what we're working on, and also we are working on trying to, I hope you can see it now. Hopefully it will appear in a couple of seconds. We're also working on enhancing monitoring. We are considering to switch to digital monitoring because so far we had sort of paper-based questionnaires, which made it sort of cumbersome to do pre-post all the time. So hopefully by switching to online platforms for data collection, we can do more of post-program surveys and some more rigorous evaluations. And we are now working with the University of Montenegro to involve them a bit more in research so that hopefully we can have an RCT in Montenegro so that we can have really rigorous evidence on effectiveness. And I would really like to thank here, I mean, you could see at the bottom of the slide the sources that I've used. So I'd really like to thank Emily, who's on this webinar, for developing this wonderful feasibility study, which you can see hopefully on the screen here, including the links. We have developed this feasibility study to help us devise a strategy on how we can embed this program. And it also has a costing study so that our partners can be aware of the cost of the program before they embark on this journey. So I really encourage you to read, although we haven't implemented all of the recommendations yet, but we're moving in that direction. And I would also like to thank really the PLH group and the University of Cape Town and Clouds Without Borders for helping us with monitoring tools and the evaluations that we've done, the analysis that we've done. So I think it's been really a very fruitful partnership, and you know, we look forward to the next steps. Thank you.
Thank you so much, Ida, for sharing the wonderful work that's been happening in Montenegro. If there has been a couple of comments and questions, so you can just pop into the chat and have a look at what people have been sharing. But I'm going to hand over now to Bernie and Leanne from the Philippines, just to talk a bit about their work that they've been doing as well. I think I have seen Bernie and Leanne on the call.
Yeah.
There we go. Hi, Bernie.
Yes. Leanne. Leanne will start. Yeah.
Okay.
Thank you.
So hi everyone. Let me share my presentation. Oh, I'm sorry. Okay. I'm sorry. How do I share my presentation?
If you look at the button next to leave, there's a share button with an arrow going up, Leanne.
Right.
And then if you click on that, you can choose to share
I
on a
see.
window or screen. So share your window and then choose your presentation from there. There you go.
Okay, so you could see this?
Yeah.
All right. So good afternoon, everyone. I'm Lian Alampay, and I'll be presenting with Dr. Bernie Madrid. Doc Bernie will share her insights after this presentation, and I'm happy to share some of our lessons in taking the Masayang Pamilya parenting program to scale. The way I've structured this presentation is really according to lessons. So I have 9 lessons listed here, but every hour I keep coming up with more. But so lessons for now, I guess. And you would see in the bar at the bottom of this slide that these are all the partners in Parenting for Lifelong Health in the Philippines. It's a multi-sectoral collaboration. And okay. So inspired by Ida's presentation, I thought to introduce the Philippines briefly as well. So we are an archipelago of 7,107 islands in the Southeast Asia. We have a huge population of about 105 million. About 40% of this is below the age of 18. So it's a very young population as well. And we are considered a low and middle income, a low middle income country because 22% live below the poverty threshold. So again, here are our collaborators for the last 5 or 6 years. I am from the Ateneo de Manila University. Our main government partner is our National Department of Social Welfare and Development, Child Protection Network, which is led by Dr. Bernie Madrid, and of course UNICEF in the Philippines. And we have been supported all these years by Jamie and Francis from Oxford University, and Kathy Ward from University of Cape Town, and Judy Hutchins from Bangor University. So the first lesson, I guess, which is really the start of our project, and I guess the story of our parenting program is the story of our scaling up process. So the first lesson for me is that it was a good thing that we started this whole endeavor with the end in mind, which is really the intention to scale. So sometimes we know that programs come about because they're needed in a particular community, or it's a good thing to do for our advocacies. But in our case, the program was really initiated for the very purpose of eventually bringing evidence-based, low-cost or freely available parenting programs to scale. A number of forces converged to bring this about. Of course, there are the global goals to end violence against children. And then at the national level, at that time, we had just seen the results of a national violence against children survey, which saw a significant proportion of Filipino youth experiencing violence. So there was a huge push to really prevent violence against children and to integrate this in existing government and partner service delivery systems. We are also aligned with the WHO, the UNICEF, and other partners, the INSPIRE strategies that were developed, various evidence-based strategies to end violence against children. And at the national level, we were aligned with the Philippine Plan of Action to End Violence Against Children. So this is a 5-year national plan. It actually ends this year. I don't know what has happened with several of these outcomes, but if you see from the slide, the first key result area has to do with parents being aware and practicing evidence-based parenting skills and positive discipline. So all of this is just to say that this project was initiated for the very purpose of partnering with government to bring parenting evidence-based parenting to scale to meet national and global goals to end violence against children. So I thought that was an important lesson for scaling, that it's an intention at the very outset. So to that end, the second lesson had to do with, well then, what do we scale? Because at that time, there were no evidence-based parenting programs. So the first step for us was to embark on developing a culturally acceptable and feasible program with evidence of effectiveness. And so the Masayang Pamilya para sa Batang Pilipino, or Happy Families for Filipino Children, was born. So it was important to develop this program as a culturally acceptable and evidence-based program, because that was our ultimate selling point to government and to stakeholders. We could make the claim that we are the only parenting program in the country with evidence, and that we could collect evidence that this program is culturally acceptable and it is feasible to implement within existing service delivery systems. So you will see here that how we embarked on that process took several years and several systematic phases, starting from cultural adaptation to pilot implementation of a small scale, to a randomized controlled trial with a 1-year follow-up, and implementing again on a small scale the teens version of the program, and embarking on sort of regional training for service providers. So this development took several phases. And this is just a brief look at the program implementation design. What did our program look like at that time when in-person programs were possible? So it's a group-based program, and the boxes I highlight here at the bottom have to do with how the program is implemented. So you see that there's a lot of collaborative discussion and problem solving, modeling of positive behaviors by the facilitators, and practicing skills. So I highlight this here because this has implications for scale. As you can see, it's a very intensive program, and that's great. And you'll see later that it is an effective program. But these very elements that made it such an effective program also made it very difficult to scale. The need for collaboration, training of facilitators, and so on, which I'll go into more in a while. So the third lesson now is then, now we have the program, and now we have to test the effectiveness, the feasibility, and the scalability, the potential for scaling the program within an existing service delivery system. And we were very fortunate in the Philippines because we have a national conditional cash transfer program called Pantawid Pamilyang Pilipino program. And this is, it was a readily available channel for integrating MAPA. So this conditional cash transfer program provides cash benefits to the most vulnerable families in the country. There are about 4 million household beneficiaries of this program. And they receive cash grants per month, subject to compliance with health education conditions. But also, one condition is attendance or participation in family development services. And this is a once-a-month program where beneficiaries discuss all sorts of issues that are relevant to family life. So we thought that this is the very area where we could introduce Masayang Pamilya. If MAPA could become part of the family development services of our conditional cash transfer program, then it has the potential to reach 4 million families all over the country. So that's what we did. The series of trials that I mentioned earlier, we did those trials within this conditional cash transfer system. And just a quick view of the results. So this is a summary of the results of our randomized controlled trial of the PLH program for kids. So as you can see, there are moderate to strong effects at 1 month after the program, and generally sustained 1 year after the program. So this again was a huge boon for scaling, a real point for advocating for integrating this program. And we also did MAPA Teens. This is a pre-post design. And again, this is a summary of some of those good results that we found. So throughout this process, and here is the fourth lesson, throughout this process and until today, it was just very important to have these sustained ongoing discussions, coordination, and advocacy with our DSWD partners. And a key challenge here is that the government agency itself goes through multiple transitions. Practically every so many months, we would have to meet with new officials of DSWD. And we will again have to present the program, introduce PLH, introduce the need for an evidence-based program. How could this be integrated in the conditional cash transfer system, and so on and so forth. And we've been very grateful for the support of UNICEF and Dr. Bernie Madrid in this regard, because they know these people very well. And in the Philippines, these personal relationships, these personal connections are really important. So much of our coordination success has been because of the relationships that have been built with these officials of DSWD. A fifth lesson, really, and I think this is something that others have alluded to in this webinar, is that there were some of the challenges we've encountered in this coordination process is that there were real tensions between trying to maintain fidelity to the program components that were effective and feasibility for scale. As I mentioned earlier, the program as it was at that time, in-person, group-based, very intensive, was not immediately seen as feasible by DSWD because their personnel, their service providers, their social workers are already overburdened. And there were real resource constraints. They could not undergo the training from being a facilitator and then having to implement the program and then moving on to becoming a coach and then moving on to becoming a trainer. So it's a very involved process of training and capacity building. And there were real discussions and issues about how feasible is this given the workload of the service providers. Another tension that we had experienced in our work with DSWD is the issue of program ownership. I think unlike one of the examples mentioned earlier, where there was a lot of co-creation involved, and I think that's so fantastic. In our case, there was less of that co-creation. So DSWD was not, in fact, involved in the earlier stages of program development of Masayang Pamilya. They already had their existing program. They already had the family development sessions. So some of the tensions had to do with, emphasizing that we are not doing away with your program, with what you've already done, which is very good. But we do want to add to it. We do want to enrich it and strengthen it because here we have an evidence-based program. So those are some of the tensions that we had to navigate with our government partner, which is still ongoing. So this is just a quick picture of that trajectory from facilitator to coach to eventual trainer. because our goal to really bring this program to scale, our goal is that these facilitators, these coaches, these trainers come from within DSWD, not from us, but coming from within. So that was a real challenge to think about. Okay, moving on to more recent events, COVID happened, which meant that our original plans for scaling the program to the different regions in our country had to be postponed because we could no longer do the in-person program. But what we did was to innovate with the help of the Global Parenting Initiative and PLH Global. So a sixth lesson in bringing programs to scale is this openness to program innovation and new opportunities to meet the need for parenting support programs. Because all of a sudden, and ironically because of COVID, opportunities to disseminate MAPA widely and massively became possible in ways that were not possible when it was an in-person program. Okay? Of course, there were challenges because of the rapid pace of the developments in these new modalities, and the timing of the delivery of these revised programs was driven by our partners because of real world and pandemic needs and constraints. So a lot of what I'm about to present next happened at a very rapid pace without a lot of the kind of preparation we had in the early years of our project. So these were the ways we pivoted to different modalities. We developed parenting tip sheets along with PLH Global. These are tip sheets that were translated to 12 Philippine languages and disseminated freely. We held parenting webinars and radio programs for service providers and caregivers. We pilot tested a version of MAPA that was delivered via chat. And finally, we have been able to integrate MAPA in the electronic version of the family development sessions. So for the tip sheets, these are the numbers that have been reached by the tip sheets. Of course, the actual extent of the downloads, we never know, but at least from Facebook and at least at, in child-friendly spaces, in different parts of the country, these are the numbers that have been reached by these tip sheets. In terms of webinars and radio programs, we've logged close to 30,000 viewers and listeners across, countless sessions we've done. And a large majority of viewers and listeners indicate that the webinars are relevant and helpful. We did our feasibility pilot of the MAPA program in chat version in Valenzuela City. And you will see here that we are very excited about this. We saw statistically significant and moderate reductions in overall maltreatment and emotional abuse, as well as large reductions in depressive symptoms and child behavior problems. And this is so important for our efforts at scale because a chat-based platform is so much more feasible and scalable, we think, than the in-person program. So there are real possibilities here for ease of scale. And last but not the least, we were able to disseminate our program in EFTS MAPA, or the electronic version of the family development sessions of the conditional cash transfer program. And it was only in this stage that we were able to co-create with DSWD. So there was a more purposive collaboration with DSWD here. We developed 6 modules over 6 months, delivered over 6 months on these topics. And these modules were delivered nationwide to all 4Ps beneficiaries all over the country via different modalities, such as FB posts, small group neighborhood discussions. Let me show you some pictures of that. Oh, so before that, sorry. So in the process of delivering these modules in EFDS, we then had to train close to 5,000 social workers and community service providers on how to deliver these modules. So you will see here photographs of the webinars that our facilitators did. I think Jen and Nice are here. And it was such a challenge, but they did it very well to translate the core components of the PLH training, which Jamie used to do with us in person. So they translated this to online settings. So they did live demonstrations of the skills. There were demonstrations using the comics, as well as practice of skills, all online. And these are the different modalities by which the modules were disseminated. So some of them were Facebook posts, about 8%. Some of the service providers did it over chat. There were wall posts, there were printed materials, and small group neighborhood sessions. So you see here in this slide pictures of, a wall post of this module on the barangay hall, or you see a parent leader facilitating the small group neighborhood session using our module materials and doing house visits. The seventh lesson, so that all that was very good. It was very exciting. And throughout that process, we were also monitoring and evaluating the outcomes for the service providers who participated in the training, as well as the beneficiaries who were receiving these modules. And so one lesson we've learned is that dissemination at scale may not replicate the effects seen in trials on the parents' behaviors. So very preliminary analysis tells us that there was very positive feedback from the service providers and parent beneficiaries on the module's relevance and appropriateness and helpfulness. So they were considered culturally acceptable, they were helpful, they were really meeting the needs and questions of families at that time. However, there were relatively lower ratings on accessibility and comprehensibility. And we figured, well, accessibility, because not everyone, not all parents had access to Facebook. And maybe because of the pandemic, not all of them actually met with their service providers in the community. There might also have been issues with comprehensibility because they had to read and absorb these modules largely on their own without necessarily the support of a facilitator. There was some evidence of effectiveness in decreasing parenting stress and depression and enhancing well-being over time. But we had no comparison group, so we don't know whether this is confounded by, the ups and downs of the pandemic experience as well. And there was some evidence of decrease in emotional abuse for the beneficiaries, but some evidence of increases in overall maltreatment on the part of service providers. However, this was prior to their exposure to the module on managing challenging child behaviors. So all of this is just to say that we, with this massive dissemination in EFDS, we were unable to see the kinds of effects that we saw in MAPA chat, as well as in the in-person program.
Leanne, can I just jump in for 1 second? We've reached the end of the webinar time, but if people can stay on the call, that would be amazing. But I wondered if you could maybe try and wrap up in 2 minutes. I know Bernie's also going to say something, if that's possible. Yeah, and I think people are happy to stay on a bit longer, so that's really great. But yeah, I just wanted to let you know that that's where the timing is at, because I know you can't see the chat while you are presenting.
I will wrap up. Thank you. So the 8th lesson is that it's been where we are now. Where we are now is it's been an iterative process. constantly reflecting on what program approaches, modalities, and components are effective and what are less so, and perhaps for what reasons and for which recipients. Okay, so we are starting to figure out that facilitator support is key and coaching support is key. So we still need to integrate these very important components in our government partner. And the last lesson is as we think about scaling with the collaboration of government, we're also mindful that there's a need to scale within our internal organization. So there's a need to build the capacity of the PLH collaborative in the Philippines to fully attain potential for scale. So there's a high demand for parent support programs. There's such a high interest in PLH MAPA, so much potential, so many possibilities, but we need to grow our capacity and grow our resources towards that end. So that's the end of my presentation.
Okay. Thank you, Lian. And since we do not have much time, I really don't have a PowerPoint, but I just want to share maybe two of the greatest lessons in this collaboration for and scaling up of MAPA in the Philippines. Uh, First, of course, you have to choose the right partners, be it government or NGO. Like they say, the right persons on the bus. And we're just so happy on having Ateneo de Manila University, Oxford, and Clowns Without Borders working with us. Now, in working with government, you really have to negotiate. You need negotiating skills, and you have to know what is important to that government partner that you have targeted. Because it's just like for us doctors in emergencies, we are taught that you immediately look at what is the most important or the most urgent for that person in front of you, and that's where you start the negotiation. You know, it's not so much about you, but about them, because if you don't, your program really no one will pay attention to it, no matter how good it is. You should know how to market, you know, and as I said, you must know how to negotiate. And with negotiating with government, you must know that budgets and manpower are really the limitations for all. You know, and when you have the program, does it mean that you have to hire new people? Does it mean that you have to ask government to budget how much, and that they're going to do that annually? So you have, and that's difficult. That's a fight by itself. And so when you come to the negotiating table, knowing that you're asking for manpower and budget, you need support from people with power. I'm sorry, but that's how it is with developing countries. You should know people who are in power who will support you, because it has to go through Congress and it has to be approved by Congress. So that's a different fight. But I guess we don't really have that much time. So I will just stop there. And maybe I don't know if there's a question and answer later, or we have a part 2 for this webinar. Thank you.
Thank you so much, Leanne and Bernie. Jamie, I see you unmuted. Is there anything you wanted to say? Oh, no, it was my mistake. Sorry. So thank you again.
But I think it would be great if we can open it up now for those who have those hardcore scaling people who have stayed on for open plenary, because it's so much great information that we've gotten from everybody, from all the different examples, and I've already been inspired and rattling off an email to think about the next kind of continuing learning series that we can do and how we can make it less didactic and more participatory, so both those who present can learn from other people, but also those who are listening can share their own experiences too.
Thanks, Jamie. Yes, I agree. Let's open it up. There was a few comments in the chat, but I think people can just unmute and you can go ahead and just share your thoughts, comments, questions with the group, and we
Maybe,
can just open it
maybe
up.
Jen, people
Yeah.
could raise their hand because there's still quite a number of people. So
there is. Okay. I'll monitor the chat as well as hand raising, and then we can just unmute and start speaking. So at the moment, there's no raised hands. Just check the chat as well. If people don't know how to raise a hand, you can go ahead and just unmute, and we'll try and just negotiate it.
I have a question that is maybe something to start off a conversation, and it's regarding the we talk about scaling programs, but usually we never define what we mean about scale. And we had a great example for Ida, who mentioned, like 80,000 families, which is the reach in Zimbabwe. If that was in Montenegro, that would be like almost 100% coverage of those who need parenting support. So maybe we can have just any ideas of people's reflections on how we have been, defining what scaling is and how we communicate that with government.
Thanks, Jeremy.
You know that Inspire has an excellent handbook available now online on scaling. It's an excellent handbook, and and you can, there's like a training program on it online for those who are interested.
Thanks, Bernie.
Link has been put in the chat too.
Richard, go ahead. I see your hands raised.
Yes, thank you. Thank you so much. And thanks, Jamie, for that observation around scaling. And I think from a Zimbabwean experience, what we have seen was scaling at different levels, because when we started implementing parenting interventions, when the project started, we started with only 3 districts. And with lessons learned from those 3 districts that were implementing dreams, we then realized that, one, in terms of the interest and the participation and the outcomes that were reported from families, we then decided to scale it up from the 3 districts that we had to all the 10 districts that we were implementing as a project. And that also saw us reaching those numbers. But then we, through engagements with governments, with the government department responsible for child protection, there was then this talk of saying, if there is this kind of interest and outcomes that we are seeing from these 10 districts that the project is being implemented, what more impact we also have if we are to scale this to all the 65 districts of the country, which is where we then envisage and intend to be through the government buy-in and coming up with these strategies to say the first stage is for us to then take ownership as a government and say, within the job description of our social service workforce, we need to ensure that all districts are held accountable in terms of the investment in parenting. So that's a good starting point that we can then say, in terms of scaling up, it can be systematic, slowly, but with the bigger picture or the broader view in place. I think that's the approach that we have also seen to be working here. Thanks, Jen.
Thanks, Richard. I see Bernice has also shared somewhat of a definition in the chat. So scaling can unfold in various ways: wider geographical coverage, breadth of coverage, depth of services, client type, and problem definition. It was the definition that she shared. Isang, I had seen your hand up at one point and then it was taken down again. So I just want to check if there's still something that you wanted to add.
No, but first of all, I had a couple of questions, but I think I'll save them for another time. But I really want to say that I enjoyed this presentation so much, and I really want to thank all the presenters. I had some questions. I wanted to know more about, I think that was from Montenegro for Ida, about cultural adaptations. And for Leanne, I think I also had some questions, but I'll skip this time. But just thank you so much, everyone.
I think the aspect of cultural adaptation and acceptability is something that's been coming up quite a bit in our discussions, in our internal discussions. So I think that is something quite interesting today's. Was you said that was for Ida?
Yeah, I think that was for Ida. Yeah, Montenegro.
Ida, do you have any comments on that question?
So maybe I can give some more context. First of all, I'm just conscious of the fact that I know we've gone over time. So I'm not, so that's why I wasn't even sure if I should ask questions anymore. So we had a comment, and this is a one-off comment from someone who supported somehow in some translations, saying that the language used in the Ukraine parenting resources were sort of foreign, that like the terms, the things you say, like do this with your child and so on, that it's not culturally acceptable. So it just got me thinking about cultural adaptations in terms of, maybe the terms you're using. Did you find that you had to change, like the phrases you used or something?
Mm-hmm. Yeah, well, we were lucky that the manual for PLH for young children was adapted by the PLH group for Europe. At around the same time as we were introducing the program in Montenegro. So they have already done that work, but I did see the original manual, and I immediately made comments to Jamie that we don't in Montenegro, like parents don't sing children's songs, especially when kids are not around. So for example, some segments of the manual were removed and changed, and the illustrated stories to sort of be more to reflect more what families look like in Montenegro. But I think the essence is still there, and I always refer to the resource by Professor Francis Gardner that parenting progress can be transported successfully from one country to another, and we did not want to invest in developing a parenting program and testing it, and it's really resource consuming. Why not use a product that is already available? It's open source, and there's so many wonderful RCTs in other countries, hopefully in Montenegro one day, that prove that the program is effective. So this wasn't really a major issue for us, and our facilitators were a little bit hesitant at the beginning, and they thought that maybe that the program would require some more adaptation for Montenegro, but I think over time they realized that it doesn't need any more adaptation, that it's perfect as it is. And we've even thought about making the program a bit shorter, but to be honest, our facilitators are saying that parents, when they start coming, they just keep wanting to meet, and they're very sad at the end of the 12th session, because we're doing this 12 session program. They're sad that it doesn't continue, and we want to sustain this behavior over time, and we haven't really made the decision to risk it and make it shorter, maybe for like universal as a universal program, but for vulnerable families, I think we're still going to stick to the 12 session program.
Well, thank you so much. That's so helpful. Thank you, Ida.
Thank you so much, Isang, for that, and Ida for the response. Is there any other comments on this? Or Jamie's also popped something into the chat. Clients Without Borders South Africa provided a lot of support with these surface level adaptations. Is there any other comments or questions? Or we're all just really keen to get another session like this going? I think it will definitely be on the cards for the near future. Having this webinar today, it really highlighted the need for us to come together and share our experiences and also learn from each other. So really thank you to everybody for joining. Thanks, Jamie. Yeah.
Jen, next time, if we could also think about a format where like maybe we have fewer case studies, but also get like from our side of like the research and implement and capacity building side, plus somebody from like the government side to share different perspectives in the kind of scaling context would be really, really great.
Yes, actually, Jamie, that was one of the things that Kathy and I spoke about. We purposely left out government in this first webinar, having government join this conversation, and we just really wanted to get the experiences out coming from the implementer side. But that's definitely something, and thank you for that, because I think what I will do actually is send out a little note to a little quick survey, 5 questions, 3 questions, just asking people what they would like from the next sessions, from the series of webinars. Definitely that was one of the things that we had put down, Jamie, so thank you for that. But I think that would be a good thing to do, so we don't take up this space in trying to get people's input on what the sessions could be about. But I saw a couple of thumbs up when you had shared that, so that would be great. If there's anything else, if there any questions, any comments, I think it was a lot of rich information that was shared today, and I think people I was frantically scrambling, just making notes of all the wonderful work and all the points to remember. It's such a lot of information, and I think Bernie ended it off well as well. Doesn't matter which or who you collaborate with, it just needs to be a good collaboration, and also to keep key people and people in power within that circle as well when you're thinking about taking to scale or just getting the acceptability from the particular country or the stakeholders involved. I think that was really, really important and quite an important point to be made. I see that there's no other questions. There's no hands up. I'm going to hand over to Jamie to end of the session. And just to say that I will send something around for people to give their input about this session, but also about what they would like from future sessions.
Oh, thanks, Jen. And I just want to thank everyone who took the time to being here today, and especially the presenters, Lisa and McGerald and Diketso and Carol and Leanne and Bernie and Ida for sharing your insights and sparking this continual discussion that we will continue to learn from each other. And as time goes on through the Global Parenting Initiative and with Parenting for Lifelong Health and the Super Study. I also just want to thank Genevieve for organizing this. This was just a great webinar to have and to kick off our July. So congrats for that. And as Genevieve said, you'll be hearing for us for future exchanges as well as feedback on how to make things even more informative to you. So wish you guys all a very happy and peaceful weekend. Thanks.